A passive transfer of drug is movement of drug across a membrane without any need of energy. Energy currency of cell is ATP, adenosine triphosphate. In passive transfer, cell doesn't have to spend any energy in form of ATP to transfer the drug. Drug is transferred in a direction of concentration gradient, which means from higher concentration to lower concentration. Outside of cell is a higher concentration and inside is lower concentration. Hence the drug is transferred from outside to inside. And once there is equilibrium in concentration on both sides, transfer is stopped automatically. Passive transfer of drug use basic laws of physics, which is movement from higher concentration to lower concentration to achieve state of equilibrium. In passive transfer, these are the two types of it: simple diffusion and filtration. In simple diffusion, drugs which are lipid soluble or unionized are transferred via simple diffusion. The speed of diffusion depends on the degree of concentration gradient, lipid solubility and ionization. Sometimes simple diffusion is also known as lipid diffusion because most drugs follow this as they are lipid soluble. In filtration, there are small aqueous pores on cell membrane which are also passage for drug to transport. Diameter of these pores is 7 Armstrong and aqueous soluble drug with molecular weight less than 100 can easily pass through it. Now note the difference between these two. Both simple diffusion and filtration transfer the drug across cell membrane in the direction of concentration gradient from higher to lower concentration. But simple diffusion is used for lipid soluble drugs only and filtration is used for water soluble drugs only. In simple diffusion, a lipid soluble drugs are easily dissolved or permeated into cell membrane because cell membrane and drug both have lipophilic properties. The cell membrane is made up of phospholipid, which is a lipid. On the other hand, in filtration, water-soluble drugs are transferred via aqueous pores because cell membrane are lipophilic as well as hydrophobic properties, which means any water-soluble drug cannot interact with cell membrane, and that's why there are aqueous pores which help in transfer of drugs.